of interference. Just a brush up. Today we're going to be talking about dental photography in pediatric dentistry and early orthodontic uh, dentistry. Today's session will be having introduction. Uh, we're going to be talking about the challenges that we face in documenting of pediatric cases, what is the equipment, and we're talking about the workflow. After that, we'll be having an assessment, and after that, we'll be taking up questions for question and answer session. In introduction, we spoke about why dental photography is important. We have more than 50 applications of dental photography in dentistry, including treatment planning, monitoring, prognosis, publications and research, medical, legal, and insurance purpose, and record keeping, and much more. A couple of challenges that we face is acceptance by the patient, especially the child. So you have to make the parents understand that dental photography is a part of your protocol. It is not a choice, and you do document for each and every case. So the parent or the guardian does not get a choice whether to decide or not. Documentation is vital for them or not, but you have to document all your cases, especially nowadays. The best time to introduce the equipment in front of the child for documentation is when you're not on the dental chair. Introduce the equipment to the child before you make them sit on the dental chair. Probably the reception area is a good choice. Maybe you can take a picture of themselves, like a portrait of them with their parent. Or if you're already on dental photography settings, I would request you all to take a picture of the thumb or a small toy so that the child knows that the equipment is not going to harm the child. It's a non-invasive equipment. That's what really matters to the child, and he's going to accept your treatments better, and even going to accept that documentation is not going to harm them. Then we went on to discuss equipment. In order to understand equipment, we spoke about the reverse concept by Dr. Mayur Davda. In that, we spoke about what is photography. So photography is made up of two Greek words, that photon and graphos. Photon means light, and graphos means to write or writing. So whenever you write something with the help of light, it's called as photography. And in dental photography, the source of light is flash. So we have four different types of photography that we use routinely. That's inbuilt flash, twin flash, ring flash, and studio light. Inbuilt flash is there in almost all the cameras. What I did not tell you is the professional cameras, means the high-end cameras, do not have inbuilt flash. So you can see I have a camera over here. It's a full frame camera. It does not have an inbuilt flash. All right. But entry level cameras like a crop sensor camera does have an inbuilt flash. So can you use inbuilt flash? The answer to that is yes, very much you can, happily. But are you going to get great results? I'm not really sure about that. We have better options for that. So what are the options? Mm, if you are into aesthetics, you can go ahead and buy MT26 EXRT. If you're a Canon user, this is really great for anterior aesthetic cases. But if you're into orthodontic cases, for me and for most of the people who are not into aesthetics, like maybe oral surgery, periodontics, orthodontics, pediatric dentistry, ring flash is a better choice because it's easy to use and much more convenient. So the ring flash for Canon is called MR14EX2. Nikon does not make its ring flash. This is something that you should be aware of. This is not a ring flash, although it looks like a ring flash. All right, this is a ring light, so don't fall for it. Although it's very cheap, this is a continuous light source. It's not really that powerful, and definitely not recommended for dental photography and documentation. Then we moved on to studio light. That was the last slide before we got disturbed and went off track. Studio light is important for me, yes, because it gives me brilliant portraits. So do I suggest that you buy studio lights? The answer to that is definitely yes. Other than great portraits, it is also going to give you a beautiful glamour photography, you know, uh, as well for tabletop photography, taking pictures of their laminates, veneers, great pictures. It'll be an add-on that you can give to your patients, a great memory that they had in your clinic. So studio light is a great investment. It's definitely going to pay off very well. So it's a must-have in my list. So that completes about the flash, and now we speak about lenses. So typically you get this lens for free whenever you buy any camera that's a beginner level camera. It's called as the 1855 lens. So the question is, can you use this lens for dental photography and documentation? The answer to that is no. Why we cannot use this? Number one, this is a zoom lens. Zoom lenses are not suggested for documentational purposes. The other reason is the focal length of this lens is 1855. I don't want to go into focal length right now, but just keep in mind that there's a very less focal length and it's going to cause a lot of distortion. Since we are documenting our cases, we definitely do not want a distortion happening in our publications and even in our records. So, distortion is something that you definitely don't want to have in dental photography. All right, so make sure that you don't use this lens for documentation purposes. So what lens do I suggest? What lens is going to give lesser distortion? Any lens which is having a focal length around 85 or above is going to give you lesser distortion and hence better images. So where is focal length written on the lens? This is the focal length. So focal length over here is 1855, and this is not a great lens for documenting. So a better lens is a 100 mm lens, a 100 mm macro lens. So whenever you go ahead and decide to buy a 100 mm lens, you need to understand that there are two types. One is a 100 mm normal. It's also called as a 100 mm prime. That's this one. And the other one is a 100 mm macro lens. All right. So don't get confused between these two lenses. They are not the same lenses. 100 mm normal lens or 100 mm prime lens is not what we use. So what do we use? We use something called as a 100 mm macro lens. So this is great for Canon users. But if you're a Nikon user, then you have something called as 85 mm macro Nikon and 105 mm macro Nikon. Um, you can buy whatever that fits to your camera and your budget. But a word of caution, you have to specify 100 mm macro or 85 mm macro or 105 mm macro. You cannot just say 100 mm because you might get caught up, you might get fooled by the person who's selling it to you, and you might be not able to use it for your documentation purposes. So the only lens that we use is a 100 mm macro lens, and now we speak about cameras. So basically there are two types of cameras. One is a crop sensor camera and one is a full frame camera. So if you really want to see it live, I have both of them right in front of you also. The camera, this is on your left hand side is a 700D. It's a crop sensor camera, and this one is a full frame camera. I'll just put the lights on so that you can see it well. So this one is a 700D and this one is a 6D. This is a full frame. So these two are the cameras that are there on your screen right now. All right. So what is the difference between the two? Very honestly, it doesn't really matter. Don't go for full frame cameras because various reasons. That number one, it does not have an inbuilt flash. Number two, it's very heavy and difficult to handle with one hand. And there are a limited number of choices with respect to lenses when it comes to what you can use. But if you have a crop sensor camera, you can use all the lenses that are made for your company. If you want more clarity on it, full frame camera is also called as a professional camera, and a crop sensor is called as a beginner camera. So the equation with lenses is like this. Crop sensor or the beginner level camera users can use all the lenses. They can use beginner level lenses also and professional lenses also. But a professional camera user or a full frame camera user can use only and only professional lenses. So that reduces the number of choices that you have with the lenses that you can use on your camera. So I would say this, don't go for full frame cameras because they are expensive. They don't have inbuilt flash. It's not really needed. They are very heavy. So you can go ahead for a crop sensor DSLR. All right. What is the main difference between the two cameras? The only difference between the main difference is the sensor size. So a crop sensor DSLR has a sensor size of 18 by 22 mm. It's not really that important for you to remember. And a full frame has a sensor size of 24 by 36. Just like the name goes, crop sensor has a smaller sensor and a full frame has a larger sensor. The only difference that it makes is if you are using one lens and standing at, say, a fixed distance from your subject, if I give you a practical example, say I am at a distance of 1 meter from my subject. I have one lens only with me, that's 100 mm lens, a 100 mm macro lens, and I look into my full frame camera, I'll be able to see one, two, three, and four teeth. But if I am standing at the same distance, that's 1 meter distance, and I'm using the same lens, that's a 100 mm macro lens, I'll be able to see only two teeth. So the basic concept is, it if you have a crop sensor DSLR or a crop sensor camera, it does not really matter. It's basically the same. All you have to do is step a little behind, and then you'll be able to see what the full frame camera would have seen. So basically, if you are getting four teeth with a full frame camera at a distance of 1 meter, if you want to see four teeth with a crop sensor camera, you would probably have to stand at 2 meters. It's just that it doesn't really matter. If you are into photography, beginner level cameras are actually more than enough. You don't have to invest on a full frame DSLR at all. Okay. So we spoke about flash, we spoke about lenses, and we spoke about DSLRs. So the flashes are inbuilt flash, twin flash, ring flash, and studio light. And lenses, there's only one lens, that's a 100 mm macro lens. But if you're a Nikon user, then it's 85 mm macro lens or 105 mm macro lens. So I'd probably just want to take a break over here and show you actually the lenses. All right. So let me show you the first lens. Can you tell me what lens this is, guys? If you were attentive, you should be able to answer it. Can you tell me what lens is this? You can type it down on the chat. Great. Um, do, do you recommend this lens for dental photography and documentation, guys? No. Great. So everybody is on track with me, and I'm really happy to see that. Uh, Now, can you tell me what is this lens? Can you tell me what is this lens? What is this lens? This is okay. Okay. Don't be in a hurry. Take your time and answer it. What lens is this? Look at both the ends of the lens. Look over here and look over here, and give me the full name. Don't be in a hurry to answer it, because if you hurry, you might go wrong. Right. So this is a 100 mm macro lens. This is not a 100 mm normal lens. Just because this has a golden color ring does not make it classify that it is a 100 mm normal lens. This is a Canon macro 100 mm. Okay. So this is a 100 mm macro lens. Okay. How do we confirm it? You can see that there are numbers written on the lens. These are magnification ratios. So right now I've kept it at 1:1. Now it is at 1:1.5. Now it is at 1:2. Can you tell me what is the magnification ratio now? If you can see. 1:3. Great. So Tirumalai, Brinda, Ria, Pavitra, everybody's right. So right now the magnification is set at 1:3. That's great. And that is how you see or confirm if it's a macro lens or not. So this is something that I probably want to warn you about. This is also a macro lens, but it's by a third party, and it's called as a Tamron macro lens. This is a 90 mm lens, 90 mm focal length. You can use it for dental photography, but I definitely do not suggest it at all. Why? Because it's very plasticky, the make is not good, and the most important reason is you cannot see the magnification ratios clearly. Can you see that you are not able to see the magnification ratios clearly? So you can see the 5 and 10 over here, I believe, but there are numbers above 10 also, which even I can't see. And those are your magnification ratios. Now you might be able to see. Can you see that I have set it at a magnification ratio of uh, 1 is to 1.5. It's above 2. Above 2, there is a 1.5 written above 2. But it's really difficult to see. It's one of the reasons why I hate this lens. It's not a great lens to have. And the other reason is this. So when I try to focus like this, you can see that the length of the lens is increasing and decreasing. Um, so this is called as an externally focusing lens. This is not something great to have for dental photography and documentation, because just imagine if your ring flash is attached to the end of your lens, it's going to be moving ahead and forwards with the lens. So this is not a great choice for us. This is a 90 Tamron, one of the worst lenses for dental photography. Uh, but look at the Canon 100 macro lens. Even if I am trying to focus, it does not change its dimensions. So if a ring flash is attached in front of it, it's not going to move at all. It's a very safe lens to have, great build, it's a metal body, and completely worth it as compared to a Tamron lens. This is a great lens to have. So just for saving 9,000 rupees, don't go for Tamron. I would definitely suggest that you go for a Canon. For Nikon people, you can go ahead and buy Nikon 85 or Nikon 105 macro lenses. I'm hopeful that you don't have any questions on equipments at all so far. So we finished equipments and now we consider our settings. I basically use my camera on two settings only. One setting is for extraoral photography and the other setting is for intraoral photography. All right. So the slide that is in front of you, it's for extraoral photography, and I use a shutter speed of 1 by 200, an ISO of 100, and f of 11. So a shutter speed of 1 by 200, ISO 100, f of 11 is what I use for extraoral photography. What is shutter speed, what is ISO, and what is f11 is beyond the scope of me explaining it in this session. But if you have a DSLR, maybe you can keep it on this. If you want to use mobile phones as well, even in your mobile phones, you can keep a shutter speed of 1 by 200, ISO 100. But unfortunately, on your mobile phone, you cannot change your f number. It's one of the reasons why I do not suggest using mobile phones. But definitely, shutter and ISO you can change in your phones as well. So this is extraoral settings, and for intraoral, I suggest these settings if you are using a ring flash. So shutter speed of 1 by 200, ISO 100, and f32 is what I usually recommend for Canon users. If you're a Nikon user, if you can go higher than f32, like f40, you should ideally. So these are the only settings that I use in my clinic. That is shutter of 1 by 200, ISO 100, f11. And for intraoral, I use shutter 1 by 200, ISO 100. That remains same, and f of 32. So basically what you see is I just play with my f number, f11, f32. f11 extraoral, f32 is intraoral photography. That is because I use my ring flash. Now it is time for me to show you these settings on the camera. So let me get a hold of my camera. I'll just show you how it looks on the camera. So let me just put it on for you all. Okay, since I don't have any lens on it, it's f00 because I've not connected my lens right now. But you can see that my shutter speed is changing right now. That's my shutter speed. So I'll just keep it at 1 by 200. And if I want to change ISO, I can select the ISO from here. So I can go to ISO 800, I can go to ISO 100, whatever I want, but I don't play with it. I just keep these two settings constant, ISO at 100 and shutter speed at 1 by 200. All these settings are not really important for you if you are shooting on RAW. So, um, the four most important settings in your camera on manual mode, of course, is image quality on RAW, not JPG files but RAW files, shutter speed of 1 by 200, ISO 100, and F number keeps on varying with whatever you want to shoot. All right. So let me attach the lens and show you how to change the F number. And probably you'll be able to see how I change my lenses as well. It is a little risky for me to show because I've kept it on my laptop. I think you can see it now. So let me show you how we can mount a lens onto the camera. All right. I'm just going to put my camera off, and I'm going to press and hold the lens release button. That's this one. I'm going to press and hold it, and I'm going to rotate this, and this is unlocked. So this cover of the camera is unlocked. You can see that. As soon as I take it off, I'll be able to mount my lens. But as soon as this comes off, dust particles are going to go inside. So I have to protect it from dust going inside. So I'm just going to cover it with my clothes. So you'll not be able to see the camera in the moment I attach the lens on it. So I've removed the camera cover, and I'm going to be attaching my lens onto my camera. For that, I'll be looking for a red dot because this is an EF lens. What is an EF lens? What is an EFS lens? Is there on our YouTube channel, Dental Photography School. This is a red dot. So this is an EF lens. So I'm going to be attaching it to my camera right now as like this. So I've already attached my 100 mm macro lens to my camera. So I'm just going to be putting it on. If the lens is properly attached, it's going to show me an F number or an F value. So it is showing me F32 right now. So that means my lens is correctly attached. And I'll show you. So these are my settings for intraoral photography, quite literally. So for intraoral photography, I use shutter 1 by 200, ISO 100, F32. That's all I see. And obviously one more thing, that's image on RAW. So these are the only four settings that I always check before taking an image. So my camera is ready for intraoral photography, provided I use a ring flash. So right now, this is a professional camera. It does not have an inbuilt flash. So I am forced to use an external flash, like I have to use a ring flash or I have to use a twin flash. So let me go ahead and show you how to attach a ring flash to my camera. So I'll just put my laptop, I'll just close my laptop, and I'm going to get my ring flash. So I'm going to be using this ring flash right now on my full frame DSLR. So the first thing that I'm going to be doing is putting my commander onto the hot shoe. I'm just going to slide it. I'm going to ensure that it's fully inside, and I'm going to start tightening the threads on my camera. And now I'm going to be taking the flash unit, and I'm going to be mounting it in front of the lens like this, and it's secure and it's really good. So what I was saying is, in Canon lenses, whenever you are focusing, it's not going to change the lens dimensions. But whenever you use a Tamron lens, you can see that it's going to change the lens dimensions. So even the ring flash is going to be moving with it. It's a ridiculous lens to have. It's very plasticky, very light in weight. It actually feels like a toy. And the worst thing is magnification ratios are not seen properly. All right. So I am ready with my camera equipment. I'll just put it on for all of you all. And so you can see my camera settings. Now I'll show you my flash settings. So let me just move the laptop slightly. So these are my flash settings. So what are the flash settings that are important for us? All you have to understand is your flash has to be on manual mode. And what you see over here is the ratio, that's the power. Okay, so I can go to 1 by 1, that's full power. I can go to 1 by 2, that's half power, quarter, 1 by 8, 1 by 16, 1 by 32, and 1 by 64. If I press it once again, it'll become full power like this. Okay, so this is the most important thing to take care of in a ring flash. Not really that complicated. There are two modes. ETTL means automatic and manual means manual. In manual, you get to select the power on your own. I have chosen full power right now, but probably for my first image on the typhoid on today, I probably want to keep it at 1 by 4th power. So I am all set to take the first shot. So my camera settings are ready and my flash is also ready, and I'm good to go to take my first image, provided I know where to take the image from. Basically, the last thing that you want to know is where to stand in front of the patient, and trust me, most of us go wrong over here because we don't have time. So let us try and understand. The last aspect also means where to stand with respect to our patient when we are going to take our picture. Means what should be the distance from our subject that we should stand and take a picture. And trust me, it's really simple to understand, and it's hardly going to take any time for us to understand this. So coming back to our settings, these are the settings that we chose to use for intraoral photography if you're using a ring flash. But if you're using an inbuilt flash, you have to choose. So the shutter remains the same, the ISO remains the same. But if you're using an inbuilt flash, you keep f18 if you're using a mirror inside the patient's mouth. And if you're not using a mirror and taking a direct shot, you can keep an f of 25. So these small tips are going to really help you, although I could not explain what they are, but they are definitely going to help you. Okay, these are guidelines. Just remember that these are not rules. They'll help you. They'll guide you. That f18 for mirror images and f25 for direct images. All right. Now we need to understand the workflow. All right, that's the last part of our session today. So in the workflow, you have to decide about two things. Are you going to follow any protocol, or you're just going to go ahead and just shoot with respect to the area that you're going to be concerned with? All right. So if you are into protocols, in the sense if you are into early orthodontic treatments or interceptive treatments, you have to follow a protocol that you have to give it to your orthodontist in future. Or if you want to publish it, you have to have a protocol in place. So what is the protocol that we are talking about? Protocol basically means a fixed number of images that you have to shoot if you want to publish your images or publish your case. So if you are into orthodontics, you have to have a protocol which shows these images. That is the frontal non-smiling and smiling pictures, and the lateral profile smiling and non-smiling pictures. You have to record both the sides and the close-up of smiles. So these are there in extraoral photography. If your university demands that you take pictures at 45 degrees, well, you have to, which I have not shown over here. So basically, full face pictures, frontal as well as lateral profiles, and close up pictures, close up of smile, that's frontal and both the sides. So that would complete your extraoral protocol. And in intraoral protocol, you have maximum intercuspation positions, molar relationship of both the sides, and full arch occlusal images, that's maxillary as well as mandibular. So let us see how many pictures that is. So 1, 2, 3, 4. So this is just non-smiling. So you have to have smiling as well. So it'll actually be 1, 2, 3, 4, and then smiling pictures. So 5, 6, 7, 8, 9, 9 extraoral pictures, and 1, 2, 3, 4, 5 intraoral pictures. This is a basic requirement without which your case might not be published. So you have to decide whether the case that you're going to be selecting is actually going to go for publications or not. In pediatrics, there is one more view that you would probably want to have if you are going to document cleft palate cases. That's called as the nasal view, which I do not have on my protocol right now, but if you're interested, maybe you can connect with me and I can send it across to you. All right. So these are the protocols that we follow if you're going to publish your case. But trust me, I don't do that. In most of my cases, in most of my pediatric cases, I do not record a protocol. I just go ahead and cater to what is the main requirement for my patient. That is the area of chief concern, and I just record that areas before and after, and maybe during the treatment. So I don't go with protocols in most of my cases because I'm not into orthodontics, maybe. But if you are into orthodontics and interceptives, maybe you have to start recording complete protocols. So I just go ahead and I record my area to be covered, which is also the most important takeaway of today's session. All right. So first things first, you have to imagine what is the area that you're going to be covering. All right. If you are sure of the area to be covering, you have to understand at what magnification ratio you are going to be getting to record that particular area. What do I mean by that will be clear in my forthcoming slides. But before we go into magnification ratios, you have to do one very important thing. Do not keep your lens on autofocus, because if you want to use magnification ratios, you have to put your lens on manual focusing and not on autofocusing. So your lens always should be on manual focus. Now let us get into magnification ratios. So apart from consistent settings, we also should maintain a consistent distance from our subject. If we want to maintain a consistent distance from our subject, there has to be a practical technique to do that. And that practical technique is allowed by a macro lens and a macro lens only. And let us see how to do that. So magnification ratios are very important to us because higher authorities have told us that different images have to be shot at their respective magnification ratios. What do I mean by that? What I mean by that is the full face has to be recorded at 1:15 magnification ratio. The close-up smile has to be recorded at 1:2 or 1:3 magnification ratio. The anterior aesthetics pictures have to be recorded at 1:1.5 or 1:1 magnification ratio. What do you mean by that? Let us have a closer look at what I'm trying to explain. So this is your macro lens. On your macro lens, you have a dial that looks like this. Can you tell me what is the magnification that I have set my lens at this point of time? The yellow color numbers are the magnification ratios. Yes, so Pavitra, Tirumalai, Tanya, Namrata, Kalai, Kesavraj, Malik Abdul, Nachi, Thindra, Mandeep, Gothai, Joseph, Ria. Why are only these people answering? I see there are 170 people. Can I expect answers from others as well? If you're not busy with something else, I want to know what is the magnification ratio that I've set on my lens at this point of time. Great. So Bharat, Kalpana, Aaron, Christy, Jasper, Nivedita, Nandini, Vinod, Kavita, Sundaina, Venkatraman, Mohammed. Mohammed Al-Shiri is here. Whoa, hi Mohammed Al-Shiri. Nice to have you. Uh, so Mohammed Al-Shiri is a dental ceramist from Iran. I'm not really sure about that though. Iran or Iraq or Saudi. Not really sure Mohammed Al-Shiri. So most of you are right. Don't worry about other marks. If you can see 1:1, that's more than enough at this point of time. So right now my lens is at 1:1. If I want to make it at 1:2, I have to rotate this particular ring. Okay, so if I rotate that ring and align it with this white color mark, I can change the magnification ratios that my lens is set on at any point of time, right? So let us actually practically go ahead and show you how I take my images. So I'm just going to keep my laptop aside for a moment. what I'm going to do now is I'm going to show you the magnification ratio on my lens at this point of time. But I'm not really sure if you'll be able to see it. Uh, it's because my ring flash is interfering. But I think you can see. So it's at 1:1 right now. Can you see that? If I rotate it, it becomes 1:1.5, 1:2. Can you see that? 1:3, and see the yellow color numbers only. 1:5. The topmost yellow color numbers. Okay, don't bother about the green and the white. So, okay, so I'm just going to put it at 1:1.5 right now. So it's at 1:1.5. I'm not going to touch my lens again. I'm just going to keep my entire equipment down. Okay, my lens is my flash is sleeping right now. You can see SE, so I'll just wake it up. And my power is at 1:4, and my settings are at 1/200, f32, ISO 100. That's perfectly what I wanted for intraoral photography. Shutter 1/200, ISO 100, f32 is set. Um, Flash power at 1/4, that's set for a typhodon. If you are actually doing it on a patient, you can change it. You can increase or decrease according to your wishes just by pressing the left and right button. I don't want to go into the details of it because it's already there on YouTube. You can take the liberty of going to my YouTube channel, and my MR means magnification ratio is set at 1:1.5 as confirmed by all of you all. You can see the yellow color number. Yeah, it's 1:1.5. So I just need to call my patient in my dental chair now. So please welcome my patient. That's my patient for today. So I'll ask the patient to open the mouth. Okay, so patient has opened the mouth, and patient is waiting for us to take a picture of it. So all I'm going to do now is take a picture. Okay, so what I'm going to do is show you all what is going to happen. So as soon as I show you all, everything is set, MR is set, uh, flash power is set, my camera settings are set. Um, what most of the people do is try to take a picture on autofocusing of the lens, and this is where they go wrong. Whenever you are doing autofocus, the camera is never going to focus because it's really difficult for the camera to focus. All right, so the biggest mistake was keeping the lens on autofocus. Don't keep it on autofocus, keep it on MF. That's manual focus, and set a magnification ratio for yourself. Magnification ratio is there only on macro lenses. It's not there on 1855 or any of the zoom lenses. So let us see what happens when I try to look through. Okay, so you can see that I am not in focus. So what do I do next to focus? So this is my focusing ring. Can I use that ring to focus? Anybody? Can you answer me? Can I use this ring, which is the focusing ring, to focus on my subject? Yes or no? And if yes, why? If no, why? Vishal Kumar has said yes, I can use it. Can you tell me why? Anybody who was saying no, can you tell me why? Because the distance is constant. How do that is, I cannot use my focusing ring to focus because my magnification ratio will change. At any point of time, I do not want my magnification ratio to change. So what I'm going to do is, so can anybody tell me what to do then? How do I focus? Let me get the answer from the audience. There are 170 people, so I'm sure somebody can answer this. Yes, very good. Sharat. Malik Abdul, very nice. Shahana, very good. Akmal, what is Akmal saying? JECT. Adjust the distance, Shobha distance. Yeah, I think everybody is right on track and really smart. So what I'm going to do is I'm going to follow what the audience is telling me, and I'm going to move a little closer to my subject. So let me see if that helps. So right now you can see that is becoming blurred and blurred. So I'm going to go away. So yeah, you can see that the moment I go away from the subject, it's becoming sharper. Let me show that once again to you. So when I'm going closer, it's becoming blurred. When I'm coming farther and farther away, it is becoming sharper. Are you able to appreciate it? As soon as it's a little bit sharp, you can go ahead and take a shot. Okay, let me go ahead and take a shot for you all, and I'll show you the picture. So basically, the best thing about dental photography on magnification ratio on manual focus is this: you don't have to worry about focusing. Everything will be sharp. See that? Although on the live view that you are seeing, it was not sharp, but every image will be sharp. That's because you are at f32. Okay, I could not show it to you because my shutter release was not pressing when my image was live. So I'll try it once again, but as soon as it's sharp, I'll try to take a shot. Yeah, it took a shot now. So you can see everything is sharp. You can see that everything is really sharp. You don't worry about sharpness at all, and it hardly takes any time to take an image. Let me show it to you again. This time I'm going to do it like super fast. I'm just going to go ahead. Just going to come behind. As soon as it's a little sharp, damn, I'm going to take the shot. See, is it good? See, it's really sharp. Okay, so you don't have to worry. The way people keep on struggling in front of the patient is really funny. 10 to 15 minutes of yours go into focusing. That's a really waste. That's a big waste of time. So the best way to take dental photography pictures is by changing your distance, but your magnification ratio has to be set. So I took all my pictures at 1:1. So suppose this patient is coming to me after a period of say 3 years. All I have to do is open the file, see what magnification ratio I shot the previous preoperative picture on. So I'm going to be uh, after like in 3 years, this would have been rotated like a million times. So I'm just going to put it back at 1:1.5, and I'm going to go ahead and take the same shot. And this is how you get repeatable pictures in your documentation. As soon as it's a little sharp, I'll go ahead and take the shot. See that? Everything is really sharp. See, just put my light off so you can see it better. So this is the last shot, second last shot, and in between, and this is my first shot. You can see all the images are really nice and sharp. And just zoom it up so that you can see it better. It's perfectly sharp. Okay, I never play with my camera settings at all. The only thing that I play with is my flash power. So suppose if the image that you got was little too bright for you, so what I would have done is I would have reduced the flash power, say 1/8. If you think that the image was dark, I would have gone on the other side, that's 1/2. So basically what I'm telling you is in dental photography, you don't have to touch your camera at all. uh, if you want to make the image look brighter, increase the flash power, and if you want to make it darker, reduce the flash power. That's all you have to do in dental photography and documentation. All right. And now we answer one important question: is how do we get a black background intraorally? So now we come to the most important topic of intraoral accessories. What kind of intraoral accessories should you invest on? Number one, if you want a black color background, you have to invest on something called as contrastors. Right? So this is a full arch occlusal contrastor. This is a pediatric size, and there's an adult size. And this is a buccal contrastor, also called as the lingual contrastor, or the lower anterior aesthetic contrastor. So this small part is for lower anterior aesthetics, and this big part is for buccal shots. All right. So if you are into orthodontics, and if you want to record molar relation of the right side of the patient, you are going to be keeping the contrastor like this, and you have to take the shot. Okay. If you are doing lower anterior aesthetic cases, you will be keeping the contrastor like this and taking the image. If you are doing upper anterior aesthetic cases on an adult, you have to use, or if you are doing DSD, that's digital smile designing, you can keep the contrastor like this. And the basic rule of contrastors is don't keep it close to the teeth, otherwise textures will be seen on the contrastor. You have to keep it far from the teeth. So don't keep it like this. You have to keep it like this, far from the teeth. Okay. So contrastors and mirrors, the general rule is they have to be away from the subject. But the most important thing is your contrastors should be contra-angled. They should never be straight, and they should be rigid. Means you should not be able to bend them. Let's see the other one. Even this is contra-angled, and you should not be able to bend them. Same holds true for mirrors. Your mirror should be rigid like this, and you should not be able to bend them. These are extremely heavy duty mirrors, but this 1 inch of the mirror is not the usable part. You have to use this part only or this part only. This is called as the quadrant mirror. It is the workhorse for us in dental photography, especially in pediatric patients. Don't keep on trying to put these mirror inside the patient's mouth because these are very, you require a very good opening for this. So this is an adult full arch occlusal mirror, and this is a pediatric occlusal full arch mirror. If you don't want to record a full arch patient, a picture of the patient, don't use these mirrors. And keep in mind, we never use the concave side. We always use the convex side of the mirror. But if you are doing quadrant dentistry, this is the mirror for you. In case if this gets scratched, maybe you can use this one, but only put a part of it. Don't try to put the full thing inside the child's mouth. So this is one tip that most of you can take away home. Try to use smaller accessories for pediatric patients and not big ones. So this is for recording quadrants. You can record the 5th quadrant, 6th quadrant, 7th quadrant, or 8th quadrant with this. If you're recording the lingual side of the patient, you can use this mirror. So I'll show you how to use it. So just open the patient's mouth and you can use it like this. So this is called as a lingual mirror. Okay. If you are recording the 5th quadrant of the patient, you can record like this. Can you see, guys? It's so beautiful. If you are recording the 6th quadrant, it will be like this. So I'm at 12 o'clock position and I'm recording like this. However, if I'm going to and if I want to record the 1st quadrant, I'll keep my mirror on the 1st quadrant. Alright, so that completes the intraoral accessory and almost our entire session for today. Let me just show you the last slide. Do we have something from the organizer? There's a disturbance in the sound. Yeah. Let me take you back to my presentation. So all these accessories are available on in one box called as the Magic Box by Dental Photography School. You have all the contrastors you need. You have all the mirrors you need. You have all the cheek retractors also that you need. So these are for adults. These are big size cheek retractors. And for children, since they are not going to be able to open, you have the sectional cheek retractors. These are very easy to place inside the child's mouth, and you can ask the patient or the parent or the assistant to hold these, and they're very comfortable for the patient. And if you are recording molar relation, you have something called as a V-shaped cheek retractor. This is not a pair, this is a single piece. If you are into prosthodontics, this also has something called as the gray card for shade communication purposes. If you want to have the magic box, it's available with us. If you want it, you can order it on 8655225522. The last thing is, please don't use backside coated mirrors and straight mirrors, because can you see this image closely? You can not only see the real tooth but a halo around it also. So this is because of behind surface coated mirrors. I request everybody to stop using these kind of mirrors. Can you appreciate this halo around the main subject? It might have happened if you do or use these mirrors. I'm not really sure if anybody has seen this in their documentations before, but it's because of a faulty mirror, right? Always use front surface coated mirrors like the ones that we give it to all of you all in the magic box. All right. So what we're going to be doing now is we are going to be starting off with our assessment. So I request the organizers to share the link for the post-exam assessment. People who would want to connect with me, you can see my details on the slide on Facebook. I'm there on Facebook, Instagram, WhatsApp, YouTube, Facebook, as well as email. But the most important thing is for you to be stay updated on dental photography and our events. Just join the Telegram group. But let us start with our assessment. I'll be coming back to this slide. Don't worry about it. But I request the organizers to share the post webinar assessment link with everybody. So the first question was, according to the reverse concept by Dr. Mayur Davda, one must invest maximum on the camera and least on the flash. 12% said that. Never invest on a flash. 5 people said that. 98%, 98 people, I think, that's 85% said that invest minimum on the camera and maximum on the flash. That's good to know. 98 people, at least out of the 170 people I spoke in front of, 100 people could answer it correctly. And I'm glad to see nobody said invest on a tripod. Now, the easiest flash to use in dental photography from the following options is 7 people, that's 6% said twin flash. 3 people, that's 2.6% said dual point flash. For your kind information, twin flash and dual point flash is the same. Ring flash was said by 109 people, that's 92% of the people, which is the correct answer. Studio lights, nobody said. Magnification ratio on our macro lens helps us on deciding the flash. Number one is image exposure. 13% said image exposure. I really don't know why, but I'm glad to see that close to 100 people, that's 83%, 84% said the distance to stand from our subject. That's exactly what is the role of magnification ratio in dental photography. It locks your distance. If you go closer than that, then the lens will not focus. If you go farther away from that point, it will not focus. So the most important use of magnification ratio is to fix the distance to stand from your subject. And the next question was, the best mirror for intraoral photography is a mouth mirror. I really don't know why 5 people said that. Behind surface coated mirror, I just gave you an example. I'm really shocked to see 11 people still answered it incorrectly. If you use behind surface coated mirror, you are going to get a halo. So please do not invest on them. All right. And 87 people said front surface mirror, which is quadrangle, which is the correct answer. And the remaining said straight and behind surface coated mirror, which is wrong. So you should not use a behind surface coated mirror. You have to use a front surface coated mirror. I'm really glad that I took this assessment because if you got it wrong during the presentation, I'm hopeful that you got it right at least. Background intraorally, we do post processing. Three people said that. I really don't know why. We use camera without flash. This is shocking. 13% saying that is shocking because whenever you don't use flash, you're not doing dental photography. And the correct answer was use a contrastor. That was said by um, 101 people. That's around 83%. Really happy to know. And five people said we use a mirror, and that's the wrong answer again. So we use a contrastor, but still, I'm happy to see that majority of you, that's 58, 60 people, that's 50% of you got full marks. Really happy to see. Two people have got 1 mark also, and one person has got zero also. That's cool. Anyways, so let us come back to our presentation once again. And I'm ready to take question answers if there are any from the audience. Meanwhile, if you want to connect with me on social media, that's my Facebook, Instagram, WhatsApp, YouTube, and Facebook page and email. Right. So can we start off with questions, please? The problem is I'm able to see the chat only for a few seconds. That's really tough for me. Okay, I can see it now. I can see it now. Um, Malik Abdul, about the certificates. Most of the people are asking about the certificates, so I think the organizers will be able to tell you about it.
Yes, sir. We'll be emailing the certificates to respective their emails. So they have to send the emails to the Pedo Tagore. It will be posted on the chat box, sir.
Okay, fine. So I'll start answering the questions now. So the first question was how to get a black. Can you mute, sir, please? Yeah. So the first question that I could see was how to get a black background. I would request everybody to look on my screen. I'm showing you my laptop screen right now, and I'm showing you my YouTube channel. On my YouTube channel, we have videos like I just posted this 1 week back. So there's a video on tabletop photography in dentistry in which I explained how to get a black background in intraoral pictures as well as tabletop pictures. So just go to my YouTube channel, and there are 4 videos on how to get a black background. These are those videos, 1, 2, 3, and 4. All of them are going to be talking about black background. There's one video on how to get a white background on tabletop photography, but the concept remains the same. You can apply it both in tabletop as well as intraoral photography. All right. So do we have more questions? How to set the white balance for true color reproduction? Janani, that's a very good question. So you have to understand that colors depend upon two settings. Look at my screen, everybody. That is my camera screen. So colors are dictated by two settings. One is the white balance, like Janani said. So this is the white balance. I keep it at a white balance of daylight, and I keep it at a picture style of neutral. So these two settings are going to control your colors. As far as I know, these are the best settings for reproducing accurate colors. That is a picture style of neutral and a white balance of daylight. And if you're a Nikon user, it's called picture control. And these settings will be there inside the menu and not, I mean, yeah, it's there both ways. All right. Uh, Mandeep, so please suggest how to reduce shadow while taking extraoral pictures against the wall or other white backgrounds. That's a very good question, Mandeep. So if you want a white background, what you have to do is you have to keep a studio light behind the subject. That's the best way to get it. And we also have a video on that. And that video is Creative Flash Photography, which was uploaded just yesterday. I request you to go ahead and see that video. Basically, you have to have a light source behind the subject. The light source should not be a continuous light source, means not don't use X-ray viewers and stuff like tube lights. It should be a flash. So the only qualified source for that is a studio light with a softbox. If you're wondering what that looks like, the studio light looks like this. You can see I have it in my house right now, and that's what a studio light looks like. It's pretty big, and it can give you a pure white background as well. Right, Nachi Shrithar. Sir, is it possible to see the white spot lesions clearly? Will flash hinder that? No, the flashes won't hinder that. If they hinder that, that means that your flash is very powerful. You can reduce the flash power. All right, but I have never had issues with it. If you still have it, you can send a video of what you are doing so that I can correct you. Malik Abdul, any alternative? One cannot invest in macro lens but have basic camera setup. Malik Abdul, there are options, but I would not suggest that you do it. If you want to do macro photography without a macro lens, we have a video on our YouTube channel. That is all you ever wanted to know about lenses. That's this one. And there is also one more video called macro photography. Although it speaks about general macro photography, I've shown techniques in this to take macro pictures without a macro lens. All right. Mandeep, if you want to buy studio lights, you go for Chrome FRX 400. I've mentioned it clearly in this video called Creative Flash Photography. Then Janani, so BH, can you please mention what to send to Tagore email? That's for you. What about the color rendering or temperature? I've already answered that. Tirumalai Velu is 1500D okay. So according to me, the ideal camera for dental photography is Canon 1300D. It's least expensive, very light in weight. It has Wi-Fi. So there is a video on my YouTube channel called as what is the best camera for dental photography and documentation, which is this one. I would recommend you all to go ahead and see that. 1500D, the problem is it might not accept a third party flash. So there are 1500D cameras which are accepting, and there are some of them which are not accepting. So what I would suggest is go to a store, check it. If it accepts a third party flash, means some other company's flash. If it's accepting, go ahead and buy it. But if not, I would suggest that you go for 1300D. If that's not available, then go for 800D. All right. So, we have any more questions? Any alternative? Do we have more questions? Without a contrast, I already answered that. Lingual indirect picture without shadow. I showed you already. This with this you're not going to get. This is how you'll be taking lingual pictures like this. But if you use an inbuilt flash, you are going to get a shadow. So you might have to shift to a ring flash through Tamara Sil 1M. Okay. So power of the flash and inbuilt flash, yes, you can adjust. I've spoken about it in my video over here, how you can adjust your inbuilt flash power. So that's called base flash photography fundamentals in dentistry. That is for you. Okay. So go ahead and see that. For intraoral lesion like lichen planus, pemphigus, the flash will not compromise the exact erosive nature. No, it wouldn't. But if you still do, you can send me a video or give me a video call. I'll be able to answer you. I'll be able to help you out with that. So autofocus is never used in dental photography, Vishal. Yes, you're right. So can we adjust the flash? So Ela Mathe Moru Gesan, that one was for you. This video is for you. Flash photography fundamentals in dentistry. Please watch it. Inbuilt flash is sufficient. Yes, Priyadarshan, it's sufficient, but you will get shadows quite a bit. So I don't suggest it that much. Maulik Bhatt, how much minimum cost is for invest as a PG student? So Canon 1300D should be around 25,000 or maybe 30,000 if it's a two lens kit. If it's a single lens kit, then maybe it's 25,000. I've got it for 18,000 also once. A macro lens by Canon So the golden ring lens is around 35,000. You can start off with that initially without going ahead with a ring flash. You can buy a ring flash later as well. Malik. Mandeep, thank you. Studio Lights Elim Chrome FRX 400. Okay, do we have more questions? Yes, Vishal, if you do manual focusing, only then you can standardize the pictures. Uh, Position of dentist while taking the picture. It's a very good question. Tamara, Tamarai Selvan. So it depends upon what picture you're taking. For maxillary quadrant, I usually stand from 11 o'clock till 2 o'clock position. For mandibular shots, I shoot from 7 o'clock. Most of the pictures, right? Extraoral, you can take it in front of the patient itself. It's extraoral should not be taken on the dental chair. My contact number is 865522 Can I'll just type it down for you. 865522. I have messaged you my phone number. Uh, then which type of cases need photography? We know every case needs photography. I've never done a case without photography in my life. Even if it's an OPD, I don't do it. In fact, it's better in OPD. You can convince your patients nicely. Uh, like dental exportant, is the camera accessory exportant from where we can get it? Not really. You have to buy everything from a good camera store. If you're not able to buy, you can connect with me anytime. I will probably help you connect with somebody in your city or your country. Okay, so I cannot see any more questions. Do we have more questions? I doubt if there are any more questions. So can we use Yongnuo ring flash on Canon macro lens? Yes, Pavitra, it's a very good question. You can use Yongnuo's ring flash on a Canon macro lens. So Yongnuo's ring flash comes with four rings for four different lenses. If you want to know more about it, you can check out this video called Yongnuo ring flash YN14EX unboxing and review. Is there on our YouTube channel itself. So what I would suggest the 114 people who are watching me right now is go ahead and go to my YouTube channel called Dental Photography School and subscribe to it. And we are uploading a new video almost every day. And I'm hoping that even this video should be going live. So I think I've answered pretty much everybody's questions. And it was a great session. Um, so that's it. This was my Raghu Raw or TIFF, which is acceptable format for publication. Both are good. Okay. If I am accepting a publication, I'll ask for both, not one. I'll ask for both. Okay. So thank you so much, everybody, for joining in. It was a pleasure. This was my first session after I shaved my head off and my beard off. And I'm thankful to Tagore Dental College for inviting me over.
Okay, thank you very much. Thank you very much, sir. Pledge my gratitude for the commitment and enthusiastic presentation about dental photography. And I saw your commitment, and you have clear covered everything about camera, lenses, and macro photography, magnification radios, and what are the accessories what you require for the camera. In a short session, you have explained
Yeah.
everything. Most important thing, what has attracted the pre-questionnaire and the post-questionnaire, that was highly impressive, sir. And we love to see your YouTube videos and your presented. So I think the delegates will be much useful for them to refer in future. And also, I thank all the delegates who have attended this section in a Sunday evening. And also, I thank especially the HODs of pediatric dentistry and orthodontic, especially Sharad sir, Joyson sir, Fardhan sir, and our